Hi guys, welcome back to my channel, Life of a Caribbean Nurse, and today I am going to be doing an educational session with you guys about the great asthma. Alright guys, so I've made some small notes in my book in an attempt to explain based on what I wrote. Alright, so firstly you guys need to know what is asthma, right? So asthma is a chronic respiratory disease that leads to narrowing and inflammation of the airway, more specifically the smaller airway, the bronchi, and the bronchioles. All right, asthma cannot be cured, however, it can be managed successfully. All right, so there are different things or triggers rather that can lead to an asthma attack. Triggers such as smoke, pet dander, mole, dust, etc., etc. All right. So for us to fully understand the whole pathophysiology of asthma, we have to know a bit about the whole airway system. So I'm going to attempt to break it down as easy as possibly. All right. So firstly, you know, so we inhale oxygen and we let out carbon dioxide, right? All right. So basically, inhalation start now, oxygen start go in from the upper airway, down in the trachea, then in the bronchi, then to the bronchiole, and then in an even smaller airway, known as the alveoli sacs. The alveoli sacs now, this is where gas exchange really does take place. So basically now these sacs get filled with oxygen and the carbon dioxide is removed from the body. The thing that is known, that is found around the bronchi and the bronchioles, known as smooth muscles. The function of the smooth muscle basically has to do with the fact that it constricts, that means it gets smaller, and it dilates, it becomes a lot larger, so it's easier for air to pass through when it's dilated. When it's constricted, you find that you have decreased gas exchange because the air can barely go through it. All right, so when a patient comes in contact with an trigger, right, something that triggers their asthma, whether it be a mole, whether it be pet dander, whether it is smoke, dust, etc., because there are different triggers for different asthmatic patients. What trigger me might not trigger you, right? There are different allergens depending on the individual. All right, so when this happens now, the smooth muscles start to constrict. That means it start to tighten up, it start to get smaller. When the smooth muscles now start to constrict, there are some cells in the body that is known as the goblet cell. When the goblet cell sees this going on now, the goblet cell's job now is basically to remove bacteria, to remove other irritants that enters into the lung. What the goblet cells does now, when it realizes that the asthmatic patient has now come in contact with an allergen or a trigger now, it starts to produce mucus. So we find that there becomes an excessive build-up of mucus secretion within the lungs now. So otherwise, from say the lungs are already constricted, right, because of the allergen, the goblet cells now that sees this allergen now start to react by producing a lot of mucus. So not only now that the airway becomes constricted, but it have a lot of mucus secretion building up that further cut down basically now, the likelihood of air flowing in and out of the airway. So basically we're going to find that we have air trapping going on that can lead to basically a respiratory acidosis building up, because we have a lot of carbon dioxide that is not getting to come out of the body, right? That causes respiratory acidosis and the oxygen now come in. Plus now, because of the narrowed airway, we can find that this patient now might now start wheezing. This, guys, I'm going to give a bit of gap to let you hear what a wheezing sound should sound like. So you just heard what a wheezing sound is supposed to sound like, right? Please note that when a patient is having an asthmatic attack, and it's very, very serious or very, very bad, you might hear not this wheezing only on exhaling, but you can also hear it on inhaling, right? Because the wheezing to basically here is because of the ear trapping that is going on and the narrowed pathway that the ear now has to pass through, so it creates a musical whistling sound, and that's what the wheezing is. Also, with this now, you find with the ear chopping going on, there are other early signs and symptoms when a person, before a person even goes into an asthmatic attack. Let me do that first. So this person might start having shortness of breath before the attack, maybe 2 or 3 days before. They might be having shortness of breath. They might be having a lot of coughing, frequent coughing. It happens when you're having an attack. It happens uncontrolled, the coughing, and also before the attack, because once you find that extra mucus building up in the airway, the body is going to try to clear it out, and coughing is a way that the body does try to do that too. So you're gonna have a lot of coughing going on. You might find that when you use a peak flow meter, I'm going to show you guys a picture of what a peak flow meter is. It's used to monitor what the asthmatic patient is doing, what their peak flow is like. Everybody peak flow might be different based on how bad their asthma is, but everybody has a normal for them. So when your peak flow normal is way below what it usually is, you know that there's a problem going on, and you might not need to start taking your short acting bronchodilators to try to clear that up. And if whilst taking them you realize there's no change occurring, your peak flow reading is still lower than the normal, you need to go and seek further medical help, because it's obvious that these bronchodilators are not working for you. All right. So when a patient is actually having now an asthmatic attack, all right, so they have chest tightness, because remember we spoke about the constriction, so the tightening up, the narrowing of these airway is constricted, so this causes the chest to become tightened. We spoke about the wheezing earlier. I even explained to you guys that wheezing basically is because the airway is now constricted and mucus is blocking the airway, so the little air that is coming through now, it makes a musical sound that we call wheezing. We're going to have increased respiratory rate because this patient many times is unable to exhale any at all, right? So all that carbon dioxide, and this patient is trying now to release this, so you might find the respiratory rate increase as a way to get rid of some of these trapped air and to also welcome some oxygen back inside. Cyanosis, right? Remember we said many times the ear trapping is so bad that there's no oxygen at all going in, and a patient might become cyanotic, meaning they don't have no oxygen going in the body, right? So for a black person now, you might find them look more purple, have a more ash looking color. For a person that is of Caucasian white descent, they might start looking blue, purple around the mouth area, so on and so forth. Medications are given are bronchodilators, corticosteroids. I'm going to also put in this video a list of the bronchodilators medications given for an asthmatic patient, and categorize them, so you guys can pause the video and look at the category medications that are given for these patients and go on and do a bit of reading on it, because guys, as I said, these videos are short videos that basically gives you an insight, and you're also still expected to do further reading because learning never stops. All right, so nursing intervention for a patient. So you have an asthmatic patient right before you, just so you need to know what the patient baseline vitals are. So you're going to need, when you get a patient, an asthmatic patient, you do the vital signs, what their temperature is like, what their respiratory rate is like. You need to know what their pulse rate is like, if their heart rate is fast or slow, what their oxygen level is like, what their blood pressure reading is like. That's very important. That means when you have an idea of what the baseline vitals for this patient is, when you start medicating them or start taking care of them, you know how effective the treatment that they're receiving actually is. Because if you check them now, you realize that their SpO2, their oxygen level is like below 95 to 100, maybe 89 on 5 liters of oxygen or even more. And they have received their bronchodilators, their corticosteroids, and nothing is going on. Definitely these medications are not working. Further interventions are needed. So always ensure that you have a baseline vitals to go off, and be constantly checking the vital of these patients to see whether or not they're improving or they're getting worse. That's very important, guys. Please make a note of that. Positioning of this patient. This patient is in respiratory distress, right? Increased respiratory rate. SpO2 is below what we'd want it to be, because we'd want the SpO2 oxygen saturation level for an asthmatic patient to at least be between 95 to 100. So you place this patient in an iFolus position. This will help with increasing the oxygen saturation, increasing the breathing also, because you can find that the diaphragmatic muscles are now more expanded. Also, you need to auscultate the lungs too. So you reassess the patient lungs to ensure to see if you're still hearing wheezing, or if the wheezing is now decreased. So that means it's clearing up, or the wheezing is not only on exhaling, it's also on inhaling. So you realize that this patient is becoming severely worse, and there's other things that you need to do from here. I'm going to give you some possible diagnosis that can be used for patients like these. So asthmatic patients. So we're going to talk about some possible nursing diagnosis that a patient with asthma, you could use for a patient with asthma. Okay? Alright, so when assessing your patient, based on the information given, you can either, based on your assessment, you will know whether or not the patient is having a knowledge deficiency. In the case that this patient is having a knowledge deficiency, you could use deficient knowledge as one. Obvious one is ineffective breathing pattern. Remember, we're speaking about high respiratory rate and all of that. Ineffective airway clearance, we're speaking about the fact that the mucus plus the narrowing of the airway, because of the inflammation that's going on, it causes constriction, and the mucus sometimes go as far as to plugging the airway. Ineffective airway clearance, anxiety. Imagine you want to breathe, you cannot breathe. Try inhale, get some oxygen in. It's like you can't get it in, and there's nothing you can do about it right away. You can imagine how anxious that makes you feel. So anxiety can be one. And guys, please remember, when you have a patient with asthma, it's important to stay calm around that patient, especially when that patient is having an attack. Okay? So if the patient flustered and you start get flustered, Lord God, that's not a good look. So try to stay as calm around your patient as you possibly can. And it's very important. You cannot be having like ineffective coping. You can imagine he or she is a breadwinner of the family and having now to be hospitalized because of what is going on with them. That's a lot to deal with. It can cause ineffective coping. So there's a lot of diagnosis you can get for the patient based on what is going on. But for sure, whereas airway is concerned, that would be a priority diagnosis. Ineffective tissue perfusion, ineffective airway clearance, ineffective breathing pattern. And based on what you're assessing with the patient, you can formulate your own diagnosis. Alright guys, that's for like an entirely different session, because diagnosis don't stop right here. So I hope this video was particularly useful to you. Like, share, and comment. As I said before, I'm going to put a chart with the asthma medication category. So make sure some type of bronchodilators and all of that. So you should have seen that, because I'm going to put that in. Yes guys, so do have yourself a blessed year. Be blessed, and all the best in your studies, all the best in your endeavor. And if you're just an asthmatic patient watching this video, or the parents of a patient or a child with asthma, I hope you guys also learned something from this, and all the best to you too.